Hello everyone. So today I am here to discuss a topic of education and training program in the hospital, a very new topic here. So we'll discuss what are the training programs, why they are important, what are the different strategies by which in a hospital training should be done. So let's start with why it is needed, why the education and training programs are needed. So let's start with the education and training programs are critical to the success of any safe patients handling program. So what is the purpose basically? We want to achieve here is a safe patient handling program, and for this it is very important to train in a proper manner. And what are the main topics here is the proper patient handling. Proper patient handling, equipment use, ongoing education about the benefits of the safe patient handling. For this there are many continuous training programs are there. They are going on from in a hospital, in a various departments, especially if I talk about the pharmacist perspective. So they are giving the training to the undergraduate, to the graduate, or to the postgraduate as well. They are also participating in the clinical trials. They are also giving the awareness programs. So in that way, there is an education and training program continue in the hospital. Now coming to the another the main topic is the role of pharmacist. How the pharmacists are impacting in the education and training programs. So there are some of the points, some of the important points we'll discuss. Point number one, they are offering continuous education programs. I told you previously, offering continuous educational programs to whom? Of course, to pharmacists. They could be the students, the physician, they could be the interns, nurses, for the administration purpose, how to administer the drug, what are the side effects, any new brands are there. So all these things can be assisted for the pharmacists, physicians and nurses. Then there is the training pharmacy students. Another is they also are providing some of the programs called as a residency program. So they are giving training to the residency programs. These are basically those programs where there are some of the years for which the students used to stay in the hospital. Hospitals, pharmacists may also participate in research conducted. In previously I also told they also are participating in the clinical trials, in the research programs. And research programs. And after getting the information, they are disseminating it to the hospital. Of course, disseminating to the physician, to the healthcare professionals, to the students, publishing newspapers, the newsletters accessible to the staff and public, which staff used to study, which public used to study. So this is how the pharmacists are the key role in the education and training program. Now, the question comes, which we call as the content of pharmaceutical education. What type of knowledge a pharmacist can give? So these are some of the basic specialities we can see: discovery, development, production and distribution of the drug products, how to distribute. There are different strategies for the distribution also. Inpatient, for the outpatient there is a different strategy. For the inpatient there are different strategy for distribution. Similarly, for the discovery and development production they can help. And in the creation, dissemination of related knowledge. I told you after getting the information, it is a main goal that whatever the new information pharmacist got, try to spread it. Resolution. And for the in the previous one point, the point number one, in the dissemination, how they will disseminate? Of course, by the training, by the continuous education program. Either the pharmacist will educate in their own hospital, or they can communicate to the other hospital as a guest lecturer. So resolution of drug therapy problems of the individuals. They are resolving the problems related to the patients. So in these topics, the pharmaceutical education can be given in the training and educational program. Now a point comes, here is the standards for the hospitals. What are the standards? If any hospital is going for a training, they are giving training and educational programs, what standard they should follow? So what are these points? Point number 1, hospital should be affiliated to the university. Any hospital who is undertaking the training program, they should be affiliated by any university. Another, and of course that should be recognized university. Another, the pharmacy department should be organized, as this is a point from the pharmacy. So the pharmacist is giving training to other healthcare professionals. There should be pharmacy department in a hospital. Point number 3, as there is a training, it is very important personnel should be there who want to continue the training, who want to join as a training program. So personnel should be there. Point number 4, standards. What are the standard and qualifications while selecting the applicant for the residency? So there are some of the basic qualification. What is this basic qualification is, whosoever is participating as a residency program, the applicant should be graduate from a recognized university which is affiliated by the university. This is a basic criteria for participating in the residency program. Another, as by the pharmacy department, training is given to the healthcare professionals or the students or the staff members. What are the basic facilities a pharmacy should have, a pharmacy department should have? It should have the departmental administration. Yes, departmental administration means there should be in a pharmacy, there should be a chief pharmacist is there. Then there are different departments in the pharmacy for the production of drugs. There are some of the drugs which are produced in the hospitals itself. For the dilution, there should be a dilution department where the dilution of the products are there for IV preparations. There should be a dispensing department. There should be a storage department for the quality control department. Like this. So there should be a departmental administration. Next is the collateral and interdepartmental activities. It is not like that pharmacy will do the activities in their own department. The pharmacy will interact with other departments of the hospital as well. So there should be collateral and interdepartmental activities. Another is, in the pharmacy, what happens, there is also one department which or services we call inpatient services, and there is outpatient services. Inpatient services means the services which is given to the patients who are admitted in the hospitals, whereas outpatient services means the services which is given to the patient who come and go back to the home and then come again follow up. So these type of services should be given by the pharmacy department. Ambulatory patient service means outpatient. Another, inpatient drug distribution and control. I told you inpatient services should be there in a pharmacy department. Then there is a technology and quality control activities. I told you in this chart there should be a quality control department. Then clinical services. Clinical services means sometimes auditing are there, medical review, prescription reviews there, drug utilization reviews there. So these are all the part of the clinical services. And in some of the previous lectures, I have also discussed about the drug information services. So this services which is given by the drug information center and the pharmacy is collaborated with it. Pharmacy professionals are working in it. They are giving the information regarding the query from any of the persons and they are answering it. So drug information services is also this services is also the part in the pharmacy department. So these basic facilities should be there while any hospital is undertaking training program. Now training program is also categorized on two bases. One is the internal, another is the external. First we'll discuss what is training programs. Training programs, they are basically, the main purpose is to equip employees with knowledge. Of course, in training programs, what actually we want to do is equip employees, their knowledge, their skills. If any new technology is there, try to try to get a skill to them to become a better professional and keeps them to update. As this is the health care department, so it's very important to update the information. So training could be given by the two modes. Can be given by internal as well as external. We'll do one by one. What is internal and another is the external. Come to the internal training sessions. What is, as the name mentions, internal training sessions, they are conducted by someone that already works in an organization. Name mentions internal means the training will be conducted in the own hospital. So already works in the organization. What are the advantages here? See, advantages is the point number one. They are the cheaper, they very easy to organize. So they are quicker and cheaper to organize because it is the matter. When we talk, the training are itself in the organization. Internal training sessions are easy to set up just because of it's a part of internal organization. Disadvantage is that it has the limits, the knowledge limits, because we are not taking training from any specialized one. So the knowledge is only the internal knowledge. So internal knowledge of course has its limits. This is one of the basic disadvantage here for the internal training. Now coming to the external training, as name shows, in the internal training it is inside the organization. Similarly for the external training, it is outside the organization. Yes, and advantage, external training sessions break up group thing. Why they break up the group thing? Because the training is taken from someone who is from the outside of the organization, and of course the limits are broken. So external training sessions break up group thing and offer a fresh perspectives on how things are done. Whereas disadvantage is that external training is more expensive. To manage, to organize all of the things, as someone will come from the outside of the organization, they are more expensive than the in-house training, and they will take longer to organize. So this is one of the disadvantages coming from in the external training. Now there are some of the examples for the internal training as well as for the external trainings. Let's see what are the examples of the internal teaching programs. If we are training of student nurses, of course inside the hospital, this is one of the examples. All these seminars in the hospital itself, the organization, for graduate nurses, house staff members, or any of the medical staff. Other could be training undergraduate students in hospital pharmacy. Sometimes what happens in the hospital pharmacy, students are going and pharmacist will tell about how the dispensing are there and the dilations are there. So these points will be covered in the pharmacy training. Another patient teaching program is also there. In this, this is quite similar with the patient counseling. Training clinical pharmacist. So in this, pharmacists are giving training who are superior working in the hospital. They are training the students as a clinical pharmacist. Now training residents for the residency program in the hospital administration. So these are some of the examples as the internal teaching programs. These all will be done in the hospital organization itself, or we can say own organization. So they call as the internal teaching programs. Another is the external teaching programs. In external teaching programs, someone will come from outside the hospital, pharmacist as a guest lecturer. So I told in the previous sections also, the hospital pharmacist from one of the hospital, they will come to the another one as a guest lecturer. They will tell about some of the specific technicalities related with the therapy or the drug development or any of the topic as such speaker for a specific course. And these specific course could be, there are some of the examples: product development, preparation of parenteral product, how to prepare parenteral products, I told you, for the dilution. Sterilization, there are some of the new sterilization techniques are coming, about the pharmacology of a new drug, what they have taken from the clinical trials. Now, coming to the another section is services to the nursing homes and clinic. How pharmacists are helping to the nursing homes and clinics, how they are helpful for giving the services in the nursing homes. So what is it? First we'll discuss, then why it is. So what is it? Let's first point. The primary care team, for giving assistance to the nursing home and clinic, there should be a team. So we call it the primary care team. And this primary care team is composed of nurses, a social worker, means A&M, and there are Anganwadi workers. So like this, there could be the social workers. Physician will also be the part of the primary care team, and clinical pharmacist. Here, clinical pharmacists are there, provides integrated patient care. So this basic team, this primary care team will help, they will provide the services to the nursing home or clinics. And this is what I told you, what is this team. Now, why this concept is needed? Why this team is needed? So, through this team concept, drug related problems, what they are doing, of course, they are taking care of the drug related problems, about the therapies, and recommendations can be managed effectively. Whatever the recommendations from these of the drug related problems, like I can give an example. A patient is suffering from skin rashes by taking penicillin. Yes, this is the antibiotic patient had taken. So this is the drug related problems, and this primary care team, what this primary care team will do, they will see the case, they will see the scenario, and they will give the recommendations. And what recommendations? These recommendations can be, we can treat this condition by giving anti-allergic drug. This could be a recommendation. Yes. Point number 2. Another recommendation could be substitute this drug. इस drug को क्या करते हैं? Substitute कर देते हैं with any other of the antibiotic. Another recommendation can be, we can change the dose, reduce the dose. Yes, this could be the option. So these are some of the recommendations after taking care of the drug related problems, how the primary care team is working. Now this is the slide which is showing the broad services. What are these broad services? Clinical medication review, and these all services will be done by which team? Primary care team. They are basically in the nursing homes, and this team comprises of, I told you, physician, pharmacist, nurses, social worker, all these. So yeah, I was doing the name of the services. So name of the service is the clinical medication review. Second service, staff education. Third is multidisciplinary team meeting. So in the clinical medication review, how they are working, this team is working. See, they are seeing the medication appropriateness. Means particular drug should be given for only X disease, or drug B is given for only Y disease, like this. So medication appropriateness, and in medication appropriateness not only the diagnosis but also the dose. What dose is given? Is it correct? Is it according to the standard treatment guidelines? and frequency also. OD once time a day, BD 2 times in a day, TDS 3 times in a day, and for how many days, for the 5 days, for the 6 days, 10 days, like this. So medication appropriateness will be checked in the clinical medication review, as the name itself mentions. Effectiveness, actually drug is effective for treating a particular disease. Cost effectiveness, is it cost effective? Means at the optimum cost, the effectiveness should be high. This is called cost effectiveness. Prescribing and monitoring. Monitoring of the drugs, especially which are under the neurotherapeutic index, and the patient who are suffering from the chronic illness. So these all the points will be covered in the clinical medication review. Some points are also here. Pharmacist may also consider, like drug interaction. Drug interaction could be drug-drug interaction, drug-food interaction, drug-herbal interaction. Adherence to medication. It is checked by many of the ways. I have also discussed how we can check the medication adherence. Lifestyle, because lifestyle is also participating for patients' health. Non-medication interventions means non-pharmacological interventions to change the lifestyle, to change the food, all these things. And unmet needs. What are the things which patient is taking and by which patient is not able to treat. So at that time we are avoiding the unmet needs also. So pharmacists will discuss all these points. Another is the staff education. This is from the patient perspective. From the patient's file, everything is taken and they are taken as a clinical medication review. Now the staff education. In the staff education, it involves either face-to-face education. So in this, the primary care team, they are educating to other healthcare professionals who are working in the nursing homes and clinics, and also to the patients. So involves either face-to-face education with relevant healthcare professionals, I told you, such as prescriber or nurses, to discuss relevant clinical practice. Sometimes what happens, as a standard treatment guidelines, they are updating, national formularies are updating. So it is important to discuss the relevant clinical practices. Then there is a multidisciplinary team meeting. In this multidisciplinary team meeting, what happens? They are taking decisions. This primary care team, they are taking decisions regarding recommended treatment, which treatment should be followed. As every hospitals have their own formularies, have their own treatment guidelines. So make decisions regarding the recommended treatment, which treatment should be followed, and if any condition, is there any complex case or any adverse reactions, what are the other recommendations can be followed. So recommended treatment and ensure that needs are met. Needs are met means if this primary care team is treating the hypertension, then of course it should be manageable, and at that time it's very important. It's very important that the meeting, as the next point is mentioning, the meeting can occur either face to face. It could be by face to face, it could be by phone, video conferences, or by the combination of both. So how by these all of these services, this clinical, this pharmacy and this primary care team is working on. So thank you so much everyone.